Good morning to everyone joining us from India, and welcome to this session. My name is Rahul Ravata, and I work in the Future Students team for the Faculty of Engineering and Information Technology here at the University of Melbourne. And it's my absolute pleasure to have you here today to join us for this session presented by Dr. Daniel Capurro, who'll be joining me on screen in just a moment. Before we get underway on this session that's going to be talking about the I guess digital interventions in healthcare and especially in this post-COVID world, how it all sort of comes to light. I just want to do something called an acknowledgement of country right now. Now, this is a very important aspect of meetings held at the University of Melbourne. And what we like to do is we like to pay respect to the traditional custodians and the owners of the land in Australia, which are the for Melbourne, where I am, where the University of Melbourne is, it's the Wurundjeri people of the Kulin Nations. And we just want to make sure that we pay our respects to their elders, past and present. Now, today's session is going to be presented by Dr. Daniel Capurro, who has the relatively unique distinction of, I'd like calling it being a double doctor. He's both an MD and holds a PhD in health and digital informatics. And I personally am so very excited to be able to listen to what he has to share with us today. So for now, I'm going to be sticking around in the background with our team, and we're going to try and answer some questions you might have. But otherwise, if any ideas come up or something you want to talk to Daniel about at the end, feel free to put them in the Q&A box, and we'll be addressing those in a little while. But that's all from me for now. I'll leave you in Daniel's capable hands and enjoy the session, everybody. Over to you, Daniel.
Thank you very much, Rahul, for the invitation, and thank you everyone in our audience for being here today. I will share my screen. So you should be seeing my slides, if I'm correct. So what we're going to be talking about today is this presentation that we titled Prescribing Digital Interventions to Improve Healthcare in a Post-COVID-19 Landscape. So Rahul did a bit of an introduction. I'm both a medical doctor and a PhD in biomedical informatics, and I'm an academic in the School of Computing and Information Systems at the University of Melbourne and Deputy Director of the Center for the Digital Transformation of Health in the School of Medicine at the same university. So what we're going to discuss today is first of initial understanding of what do we mean by digital interventions. Then we're going to ask ourselves a question: how do we know that they really work? And then thinking about questions around deploying these interventions in the real world, and who will fund these, and what are the next steps. So, but this is again just a framework to get us talking about this very cool world of digital health interventions. So how can we use digital technologies to improve healthcare? So we normally think of healthcare interventions as medicines or vaccines or procedures like surgical procedures. Those are things that we do to our patients to make them feel better or improve their quality of life or live longer. But that's not the only type of interventions that we can generate that actually improve healthcare outcomes for our patients. We can also think about reminders. So one thing is, giving a patient a prescription for a new drug, but the other one is, making sure that the patient adheres to that prescription, that the patient takes the medication when it's needed, that they don't forget to take the pills, and so on. So we can think of an intervention that is not a drug, but will improve the effect of a drug, or in the form of a reminder. Okay, and now that we have digital tools like smartphones, we can think about digital reminders as digital interventions to improve healthcare outcomes in our population. So that's just one example of one type of digital intervention. But that's not, so reminders are not the only ones. We can think of digital interventions like a dashboard, for example, that we present summary information to a doctor in the hospital to tell this doctor how their patients are doing, who's getting better, who's not getting better, who might be deteriorating, and predicting that a patient might suffer adverse events and intervene beforehand. So the way we organize healthcare and support by digital tools are also considered digital health interventions. At the bottom here, I have like this image of a brain because there's a lot of research being done in the adoption of artificial intelligence as a tool to provide suggestions, recommendations, make predictions about what might happen with a patient's health status, and then improve based on those recommendations. So those are also types of digital interventions. And on the right side, you can see again a smartphone, and we can think about collecting information about patient symptoms, about vital signs, blood pressure, heart rate, temperature, emotional well-being, and so on. So there's a big array of digital health interventions that are increasingly being made available in our healthcare systems. And here you can see this is a publication by a consulting company called McKinsey, and this is just to highlight the acceleration of digital transformation of customer interactions with all sorts of services. And here you can see, that the curve was going up from 2017 and 18, and then has a quick jump from December 19 to July 2020, and probably even more today. And it's, you can see that across the globe. So globally in Asia Pacific, Europe, and North America, this is all true. And we've seen this happening in healthcare as well. We've seen the explosion of telehealth interventions. We've seen the explosion of applications, smartphone applications to monitor symptoms, and a lot of barriers that were in place that were preventing us from implementing and adopting these digital innovations are quickly coming down at an accelerated pace. So this is an ideal setting to start thinking about how can we design digital health interventions that actually improve patient outcomes. And here are some just random news articles, and you can find many of these online, about how is the COVID pandemic triggering this digital transformation of healthcare. And even this is just a diagram. The World Health Organization has been working for a few years now in trying to define and organize different kinds of digital health interventions. Okay, so here you can see, for example, in this point 1.3, client-to-client communication, peer group for clients. That's a type of digital health intervention. Or 1.61 here, we can see client lookup of their own health information, and so on. Okay, so there's different types and different workflows or places where digital tools can touch the patient's experience and actually lead to improved health outcomes. And what I mean when I say healthcare outcomes is quality of life, increased survival, and reduce length of stay in the hospital, reduction in hospital admissions, reduction in the need to go to the hospital, and so on. So it could be more efficient healthcare. It could be longer lives and better lives. But this is not something new. So it didn't just start with COVID. If you go and spend some time looking at, let's say, the Apple or the Android app stores, you're going to find that there's way over 300,000 different health applications that have been designed to address some sort of healthcare problem. Could be hypertension, could be diabetes, mental health, sleep, exercise, etc. So again, this is not something new. We have been seeing a rapid increase in all these different products being offered in app stores. And again, this is just one example of a type of digital health interventions. So then the question is, do these work, and how do we know that they work? How do we know that these applications work? Well, the answer is, I would say it's fairly simple. It's in the same way that we know that traditional health intervention works. For example, when you think about a surgery, when you think about a vaccine, when you think about a new drug, what we do is we run clinical trials to test them in real individuals and making sure that they are safe and that they produce the benefits that we expect. But when you think about this, all these 300,000 applications and all the different things, digital health interventions that are not smartphone applications, most of them, or a huge majority of them, they have never been tested using clinical trials in the way that vaccines work. So again, how do we know that they work? We need to think about randomized controlled trials. And what do we mean by a randomized controlled trial? In a randomized controlled trial, you have a group of patients that you have recruited for the study, and you randomly assign them to receive the intervention, which could be the drug, it could be the procedure, it could be the vaccine. And the other group gets randomized to receiving the control therapy, so the standard therapy or a placebo, or doing things as usual, okay? And then we follow these patients into the future for maybe weeks, months, or years, and then we measure what was the proportion of patients that suffered adverse events in one or the other group. We've been reading about these over and over again this past year, because everybody's been very, focused on understanding what's the evidence for vaccines. That's precisely what has been published in randomized controlled trials. So patients are allocated randomly to receive the vaccine or not receive the vaccine. And then we measure, after a few weeks, we measure what's the likelihood that they get infected with the disease that we're trying to prevent, in this case, COVID. And then we can measure the effectiveness of this intervention, okay? So the expectation is that for digital health interventions, we should have some process that's similar to this, okay? But if you think about what everybody has been experiencing in relation to COVID vaccines, we do not only care about the effectiveness and the evidence of effectiveness coming from randomized controlled trials, but we also think about regulatory approvals. So which vaccines have been approved in which countries, for which age ranges, and so on. And that tells us that there's a very clear process to doing this. And here I compare what happens, in the drug development process, where you start with discovery and development of different, possible treatments. Then you go into preclinical research, which usually involves doing studies with cell cultures, with animal models, and then you move on to clinical trials, which are also divided into phase 1 to phase 4, where you start with healthy individuals trying to understand what's the dose and so on. And finally, then once you have the evidence coming from clinical trials, you get approval from regulatory agencies. And after these drugs and devices get approved, then countries around the world decide whether they're going to fund this, whether they're going to let patients pay for it out of pocket, or the healthcare system, health insurances are going to be made cover these new drugs. But if you look on the right hand, for digital health, we don't really have the exact same stages. So there is, of course, a lot of activities going on in terms of discovery and development. There has been very preliminary activities, very incipient activities in terms of regulatory reviews. But there is not much around preclinical research, clinical trials, and then processes to decide what's going to be funded. Let's say if I'm an entrepreneur and I have a startup company that developed an application that supports patients with insomnia. They have trouble sleeping. And you develop an intervention that's delivered through the smartphone application. Let's say you get approval from an agency to market this in a particular country, but then who is going to evaluate this and decide whether this should be prescribed to patients with insomnia? And is somebody going to pay for this? And then you start, as a startup, then you start thinking about, well, what's my business model? Do I sell my app on the App Store? But then how do I make sure that patients that actually need this are getting access to it? So the funding decisions become very, very important. And that's why we have, on the left hand, I have, an entrepreneur with a brilliant idea of a digital health intervention. On the right hand, I have a hospital that, might have a need to implement that. But then we have this valley in the middle that separates them. And I inserted there a trash bin, because that's where most, publications or initial ideas end up, and they don't end up being translated into real healthcare settings. So that's a problem that we have, because we think that most of these digital health interventions may be effective, that the risk is relatively low, but then we don't have a pathway to translate that into real hospital settings, for example. And we've been here at the University of Melbourne working on a project that we call the Digital Health Validitron, okay? And the Digital Health Validitron sits in between entrepreneurs, startups, and hospitals, so we can help bring these ideas into a more mature version of them that is ready to be tested in hospital, in real clinical settings, in clinical trials. So let's say, again, if we follow this example of a startup that has a smartphone application to treat insomnia, okay? And the Digital Health Validitron will be a place where we help this startup company build the components that are necessary to plug this into the healthcare system, to make sure that the system will be safe and usable by patients, will be adopted by clinicians, and then it is highly likely to succeed. So in this Digital Health Validitron, we've thought about 3 different stages. The first stage is understanding what's the feasibility, what's the impact, what are the potential avenues for funding. For example, using the same example of the insomnia app, what's the feasibility? Is it possible to prescribe this application to patients with insomnia? What's the potential impact? That means, how many patients in a country suffer from severe insomnia? How many might be willing to use a smartphone applications to improve their sleep patterns? And then who may pay for this? Do we need patients to pay for the service by themselves, by subscribing to an app? Or do we want hospitals or healthcare systems to pay for these? Do we want insurance companies to pay for these? And what are the different implications of those decisions? And then on stage 2, we have this social technical design component, where we take the innovation and understand what are the needs for patients, what are clinicians' needs, and how do we make sure that this app actually fits their existing way of doing things. Then we also have a digital ecosystem where all different parts and pieces of a healthcare system, so we can test that this smartphone application will actually be work with the rest of the healthcare system, and a simulation lab where we can actually test these workflows. And finally, stage 3 is the actual clinical trial, which is, again, as we discussed before, what you would normally do when you're looking at testing whether a drug works or not. And when we think about this socio-technical design component, we think about the service design. So how is this going to work? This smartphone application, again, using the same example of a smartphone application to treat insomnia. Do we want patients to learn about that through the news, through social media, and then go to the App Store and download it? Or do we want it to be formally prescribed by a clinician in a specialist clinic or a general practice? Because that has different implications in terms of payment, in terms of funding, and so on. So we have developed frameworks to make sure that all these different startups have a very systematic way of understanding the best service design. Then we take these ideas and we co-design with both patients and clinicians what are the best ways to implement this innovation into real clinical workflows. Are we targeting clinicians in the hospital? Are we targeting clinicians in their general practices? When is the patient going to be prescribed this? Do they need to write an electronic prescription, or are we going to make sure that whenever the patient is diagnosed with insomnia, the patient is automatically going to receive an invitation to download this application, for example? So all these different considerations are developed with patients and clinicians in mind, and we bring them to the lab. We have discussions, we have simulations, and then we test all these different ideas with them so we can get quick feedback. And finally, we work with our experts in human-computer interaction to, again, understand what's the best way to generate interfaces that are useful, meaningful, and easy to use, easy to operate, easy to understand for both patients and clinicians, to make sure that they will adopt these in the long term. We also have developed this digital ecosystem where you have all these digital components like electronic health records that look and feel like what a hospital would normally do. We have an integration platform with all the plugs to connect all these different components. And we have simulated clients that look like smartphone applications, and we have simulated patient data, so we can actually test all these different workflows and make sure that all the things that we have been designing with patients, with clinicians, they actually work in the real world. And finally, we are almost about to complete the simulation lab, which is in this building that you see on the right, which is called Melbourne Connect. It's a building that's at the main University of Melbourne campus. The School of Computing and Information Systems is there. And one of the facilities that's going to be living in that building is this simulation lab, where we will have general practitioners' office simulated, where we will have patients' homes simulated, where we will have aged care bedrooms simulated, so we can actually test all these different workflows that we first designed, then we implemented them using our digital ecosystem, and then we get to finally test them. Okay, so all these different components, what they're doing is helping us set up the necessary pieces for these, what we see here, the preclinical research and the initial stages of this clinical research. So the phase 1 and 2 trials could happen in these simulated environments, and then we will be ready to bring these innovations all the way to clinical environments like hospitals, like specialist clinics, so we can actually run the phase 3 trials and test the effectiveness of these digital health interventions and start to close this gap that I was showing you here. And we've been working on a few examples, and I can talk about them later. We are working right now in a research project building a social network to provide peer support for brain cancer survivors. So these are patients that have survived brain cancer, that underwent treatment, and then they're in their life after this treatment, we know that they benefit from receiving peer support, but there is no formal way of doing that. And patients sometimes use social networks, but there's, of course, privacy implications of using standard social networks. So we're creating a special type of social network that allows patients to interact with each other, to access high quality resources, to connect with their treating teams, to connect to the hospitals where they receive their initial treatments. And this will be connected to the existing electronic health record. So we're going through this validitron process to understand, what do patients need, what do clinicians need, what does this application look like, and so on. Another project that we're working on is generating different scenarios of telehealth for older adults. During COVID-19, there has been a huge push to take a lot of health services into telehealth. The problem right now is that all these different telehealth services are disconnected one from the other. So a patient might seek care at a general practice, and they get a telehealth episode or a telehealth visit, but maybe then they need to go to the emergency department, and there's no interaction between those two processes. So we're using this digital health validitron to create meaningful workflows for telehealth that cross multiple clinical settings, from general practice to emergency departments and hospitals and aged care facilities. So, for example, an aged care facility would be able to seek care at an emergency department, connect to the emergency department first. They can decide whether the patient needs actually emergency department visit, or they can go to their general practitioner, and it's all integrated using this digital health validitron and the digital ecosystem that we created to test all these different environments. And then after we have all these different processes tested, we can go to our state government and say, hey, this actually works. Patients love it. Clinicians love it. All these different components already comply with all the necessary plugs to plug them in to the existing healthcare system. So we're ready to test it in real clinical scenarios. And finally, there's another project that we just began working into, creating web-based interventions to improve quality of care for patients that are undergoing palliative care. So you can see that in this ecosystem, we are building all the different components so we can have a pipeline of approval or validation of the effectiveness of digital health interventions, just like we have for the drug development process. We are generating that for digital health interventions. So we can then go back and look at these 300,000 applications or more that are available now in the smartphone app stores, and systematically test whether they are useful, whether they're not useful, whether they produce the benefits that they claim to produce, and so on. With the final goal of taking innovations that are, created by brilliant people, brilliant students that are in our university, that are coming to Australia, and propose an accelerated translation pathway. So we have a clear pathway to bring these innovations and prevent them from dying in this, valley of death in terms of technology translation, where most of these innovations end up in the garbage bin. We want an accelerated translation. Those that demonstrate value can be quickly adopted by hospitals and healthcare networks. So in the end, our patients can finally benefit from this digital transformation of healthcare. So the invitation is very open. The invitation, all of these things that I'm telling you are happening here at the University of Melbourne. We normally work with students that are interested in participating in different parts of this process. So everybody is invited. Please bring your ideas, There, I give you my email address, Twitter account. At the bottom here, you can see that the Center for Digital Transformation for Health is at DT4Health. That's our Twitter handle for the center that houses this digital health validitron. So with that, I finalize my presentation, and I'll be happy to take questions from the audience or discuss any other issues that you might be interested in discussing. So again, thank you very much, and I'm happy to take questions from now on.
Excellent. Thank you very much, Daniel. That was phenomenal, really interesting. And we've had a whole bunch of really interesting questions around this as well. So might just sort of make a start on these. And to everybody, if you've got some more questions that have been buzzing around your head, feel free to ask them now. We'll try to get through as many as we can in the time allowed. And we'll get underway. So I think a common theme that's come through is, I guess, this idea of the technologies, and particularly artificial intelligence that was mentioned, and then you think about privacy and that sort of information. What are some of the pitfalls, I guess, in the longer term of as we move towards this more digitization in the healthcare industry?
Mm-hmm. Yeah, so I think that the effects that we've seen with the widespread adoption of internet technologies and social networks in particular, we can actually envision some of the downsides. So that's a really important question, and that's a really important aspect that we always need to consider when we design these new digital health interventions. There are privacy regulations that describe exactly what can and what cannot be done with private health information. And different countries have different regulations, but for example, here in Australia, as a patient, you have a very tight control on who has access to your healthcare information. The regulations that around artificial intelligence, they're just starting to become evident. So I think there's if somebody is interested in conducting and studying this area and studying legal regulations and ethical implications and philosophical implications of privacy rules in the healthcare domain, that's a space that's definitely open for innovation. So we don't have all the answers, absolutely, and the invitation is that the University of Melbourne is where we have the combination of legal experts in technology, experts in healthcare, where you can come and make contributions and start answering those questions.
Brilliant. Thanks for that one. I'm seeing some questions that are quite related as well to some particular aspects of the presentation day. And I think you did cover this briefly, but when we're talking about healthcare apps and comparing that to the traditional process of trials and control groups and things like that, how can you really estimate a control group or things like that with a digital intervention such as an app?
Yeah, so depends on the size of what you want to test. The size in terms of you can be testing, for example, patients using the application versus not using the application. So you would normally design a study where you recruit patients in the hospital, and let's say the same example with insomnia, you would recruit the patients before giving them access to the app. You randomly assign them to the group, and the group that gets the patients that get assigned to the group, the intervention group, they get access to the app, and the other group doesn't get access to the app. And then you can compare outcomes, in a few weeks. Another option would be giving them access to an application to both groups. One application has the intervention, for example, let's say mindfulness training to improve sleep patterns. The other group may gain access to an application that only contains information about insomnia. Okay, so you give them access to an application to both groups, but the content of that application is different across two groups. And there's also all these, what we call A/B testing, which is a lot of things that what Facebook does with all of us, or Twitter, they test all different features of their application. So they randomly allocate users to one experience versus the other experience. Usually what internet companies or tech companies want to maximize is the time we spend on their applications. In the case of healthcare, we would do small changes and understand whether that improves patient engagement and that improves patient healthcare outcomes in the long run. But the principles are the same.
Yep, I think that answers it really clear. And I think talking about the simulation lab that you've mentioning we have at the School of Computing Information Systems, is the data for those simulations, are those from actual records of patients, or are they like generated by another means?
We have different ways of doing it. We have access to some a few data sets of anonymized data, so data that has been stripped from all personal identifiable information like names, addresses, phone numbers, identifiers, and so on. That's one thing. And the other thing is using synthetic data sets. And there's different ways and algorithms that you can generate data that looks like real data, but it doesn't belong to any patient because the computer generated it for you. So that's another way that you can generate data that can be used for these kind of studies and simulations.
Awesome. And then I think a common theme that's coming up, I think you've inspired a few people here, and there's a lot of people who are interested in this digital health field. And I think there's sort of two main pathways as well. There's, I guess, similar to you, those with a health science medical background wanting to transition to that side. And then on the flip side, those who might not have that healthcare background, but really want to be a part of this technology. Do you have any tips on the best way to go about that?
Oh, absolutely. I would say that there are way more than those two pathways. People that work in digital health come from many different aspects. I would say, what Raul described, these, from health sciences and from information technologies, those are the main feeders of professionals that work in this area. And there's for example, here at the university, we have a graduate certificate in digital health and health informatics, which is something that a lot of students coming either from health disciplines or from information technology and computer science, they take this course to sort of get introduced to this topic of digital health, and then they can go on and do a master's degree, for example, or a PhD in this domain. I have multiple PhD students, and they tend to be computer scientists that are working in this area of healthcare. And I think it usually is a good combination, because then I can provide them with the information about, all the learning that needs to happen to understand the healthcare side of things. They bring the computer science knowledge, and then they can produce, very impactful research in this domain. But we also have behavioral scientists. A lot of interventions in healthcare involve behavioral changes, and doctors, we are relatively bad at, understanding what drives behavioral change. So we normally work with behavioral scientists that help us understand what are the best ways to facilitate behavioral changes. We work with sociologists, we work with psychologists, we work with, human-computer interaction experts to design these interventions and so on. So again, it's a broad field that a lot of people can bring their own expertise. Designers of experience. That's also a large group of professionals that can work in this space.
Very interesting. And I think a question that's just come through then that I think builds a bit on that last aspect. Something you were talking about near the end there with telehealth for older adults and that sort of population. Can you give us maybe another example or so, like how we can address that?
So this idea of telehealth and older adults, or we're trying to, so telehealth, the concept of telehealth is over 100 years old. It started with early days of the radio, and providing healthcare support in ships that was sailing across the world. The concept of telehealth is pretty old now. It's been very popular in this past year because now we desperately need it. But we're trying to move into this concept of virtual models of care. So what parts of the healthcare system could we make virtual? So of course, patient visits to their doctor can be made virtual, and also, for example, physiotherapy sessions, and so on. And so older adults are a particularly important section of the population, because it's a combination of patients with different levels of education, with different access to technology, with different technology savviness, so that not everybody knows how to use technology in the same way. So we know that there needs to be special research done to understand how older adults approach the technology, how are they going to adopt these different pieces of technology, what kind of services do they need, and so on. So there's here at the university, in the School of Computing and Information Systems, we have a big group of researchers studying precisely that. There's a group of researchers studying how can virtual reality be used to address social isolation, okay? Because one effect of the pandemic that we are seeing, based on all the lockdowns and social distancing measures, is again social isolation, and we think that technology can help us bridge the gap that has been generated there. So again, many research opportunities in this space, and to generate big impacts, because this is a field that, although it's been around for quite a while. I did my PhD in health informatics. I started back in 2008. So that's, 13 years ago. Nobody knew that COVID was going to hit us 12 years later. But again, it's been a nascent field, and there's so much more to be done here, because we think about, artificial intelligence, virtual reality, but when we go to the real world, what's happening? We have trouble scheduling appointments. Governments sort of have issues with deploying these, medical records. So basic things are still, we still struggle with them. So the gap between what the researchers are doing and what's happening in the real world is still very big. So there's a big potential to close that gap with meaningful research.
Yes, incredible. And I think something that's sort of, I'm seeing another thing come through. It's, by the way, thank you everybody for your questions. It's really interesting to have almost too many to choose from, but I'm getting some really good themes here. And in particular, we've been talking about research around the end user in some cases, where those, with access to technology and using it in a certain way. But on the flip side, what are some digital interventions on the larger scale, where it might not be, I'm using my phone, I might not have a phone or something like that, but what are some examples of digital interventions, I guess, in the wider population? Does that make sense?
Yes. So when we talk about digital intervention, I would try to use a broader sense of digital. So it doesn't necessarily mean something that is happening on your smartphone. We have done studies testing, the effectiveness of text messages to improve people's adherence to preventative healthcare measures, like, for example, cervical cancer screening or colorectal cancer screening, and that can reach wide sections of the population. We also know that social networks can be used to reach hard to reach populations. So there's usually, when you're a baby, your parents take you to the doctor to get your checkups, your vaccines. But when you enter middle school, most children and teenagers, they never go to the doctor anymore until they either get pregnant if they're women, or something happens, like there's a you break a leg, or I don't know, you're 40 and then you need to go other kinds of screening because you might have hypertension. So there's a few years there where you are considered a hard to reach individual for healthcare purposes. So there has been research done in the use of social networking sites to precisely reach those patients for age relevant healthcare interventions, like for example, reproductive health and so on. So there are many examples like that.
And then maybe this might be a very big question without a simple answer, but do you think that all these different digitizations and I guess digital interventions, will it make healthcare more expensive or more affordable, or what do you, how would you answer that question?
Well, I think the answer is we need to test those assumptions. We think that it will make it cheaper and more accessible, but we also know that there's a section of the population that might be excluded from digital interventions, because there is a digital divide between countries and places and individuals with more access to health technology. So we need to be aware that this is a potential unanticipated consequence, and it's not. And we need to test these interventions to make sure that they're effective, and that they're cheaper than the traditional way of doing things. So again, it has the potential to make healthcare cheaper, but we need to test. We cannot just assume that it's going to be cheap because it's digital, because usually in healthcare, not just in digital, but in healthcare in general, we are plagued with examples of things that we thought were going to be useful, and then 10 years down the road, we realized that they were not as useful as we thought. There's a book that I love that's called Ending Medical Reversals. It's written for lay audiences. So if somebody wants to read about that, it's a very interesting read of things that didn't go well in healthcare. And we don't want digital to go through the same set of experiences. So we are advocating that all these different assumptions need to be tested in formal studies.
Excellent. I think we're starting to get near the end. I might just pull out one or two more questions. And to anybody, if you have some more questions, you can always subscribe to hear some more updates from University of Melbourne. We run sessions like this quite often to try and bring people like Dr. Daniel to you and to hear about what he has to say. Now, this might be a bit of a cheeky one, but do you have any suggestions for some of the entrepreneurs who might be here about an idea, a good idea in healthcare, something to address? And I guess especially for someone coming from a computer science engineering background, like, let's say that's the one. Do you have any idea that they can go and take and make bajillions of dollars from?
So I think, the bajillions of dollars, I'm sure there are many out there. I think that, making, if you can solving the problem of monitoring patients outside of healthcare environments, and we know that there are, smartphones and smartwatches, but usually patients don't adhere to them as long as we would want them to. If you think about, we have about 400 participants here in the audience. If you think about if you have downloaded an app to increase the amount of exercise that you do, or improve your sleep, or improve some aspect of your life, the likelihood is that you stop using it after a few weeks or a few months, and few people stick to these interventions. So I would say, if you're able to solve these things, a method to make sure that people adhere to these interventions in the long run, you will probably make bazillions of dollars.
Yeah, and I mean, hopefully it's not the only motivation for people, but it is an important motivation at times. So you should keep that in mind. Look, Daniel, I think we might wrap up the questions there. There's a lot we didn't get to, and apologies everyone we didn't. There were some really interesting ones there as well. But just, do you have any parting words for our audience or advice moving forward of any sort of type?
I would say, parting words, I would say this field of digital health is something that it's just starting. It feels like, COVID has brought way more interest in the space of digital health. And one of the issues is that there are not enough professionals trained in this area to hire. We constantly have openings for researchers, companies that want to hire experts in digital health, and there are not many people, not here, not in the US, not in Asia, not in Latin America, Europe, everywhere in the world, we are lacking professionals with the right skills. So if you think about health and technology as a potential area to focus your future career, I think it's a great choice. You're going to find lots and lots of opportunities. And I think that the University of Melbourne, I actually moved to the University of Melbourne from, I used to work in Chile, in Latin America, but I moved to the University of Melbourne because I think this is the perfect ecosystem to develop high impact research and development in this area of digital health. So, everyone is invited to join us.
Thank you very much, Daniel, for the information shared today, all these examples, all these questions that you've managed to address. And to all of our audience, we hope you've learned something new today. Hope you've got something you can take away. And maybe one day we'll see you at the center here in Melbourne, and we can continue to develop and share these interventions with the rest of the world. I think we might wrap that up for the day. There's some messages in the chat. So thank you for joining us. It's been a pleasure here at the Faculty of Engineering and Information Technology to have you along. And we hope to hear from you all again at some point in the future. Have a great rest of your day, and we'll talk to you in the future. Bye-bye.
Thank you so much.